exploring urethral stricture disease. We are going to look at the incredible ways human beings have tried to fix this very specific biological traffic jam, from the ancient world all the way to modern high-precision surgical suites.
So let's kick things off with a massive historical question. How exactly did ancient healers approach blocked internal pipes, millennia before modern surgical suites, antibiotics, or anesthesia were even a thought? You might assume this is a uniquely modern problem caused by medical devices or, modern trauma, but the historical data tells a completely different and frankly astonishing story about human anatomy.
The Urological Society of India notes that urethral strictures have actually been known to mankind for 5,000 years. The historical record from the ancient Indian physician Sushruta, who operated somewhere between the 6th and 8th centuries BC, brilliantly illustrates this ingenuity. He didn't just observe the problem, he actively designed urethral probes and dilators to widen the blockage, and even described methods of urethrotomy, which literally means cutting the stricture, centuries before the Common Era. It just goes to show you that urethral strictures are a problem as old as civilization itself.
Here is our roadmap for today. First, an ancient plumbing problem. Second, anatomy of a stricture. Third, global causes and trauma. Fourth, the myoplasty solution. And finally, recovery and realities. Moving right into section 2, anatomy of a stricture. The body's plumbing.
It's really fascinating when you clearly map out the urethra's path. You can trace the route right from the bladder, through the prostate, and out through the penis. The urethra isn't just some simple, uniform garden hose. It's a highly dynamic pathway, passing through completely different tissues and structures. And because of this complex route, there are multiple specific points where damage can occur, creating a narrowing or a bottleneck. This is exactly what doctors call a stricture.
Now, there is a absolutely crucial clinical distinction we need to make here. Medical guidelines firmly differentiate between a stricture and a stenosis. A true urethral stricture specifically involves the spongiosa. That's the spongy erectile tissue surrounding the urethra. When this particular tissue gets damaged and scarred, it narrows the pathway and completely changes the normal dynamics of how the system voids. On the flip side, if the narrowing happens in an area without that spongy tissue, well, then it's clinically classified as a stenosis or a contracture.
And these blockages, they can happen pretty much anywhere along the route. They might pop up at the very tip, known as the meatal region, or just behind it in the fossa navicularis. They can happen along the penile urethra or deeper down in the bulbar region. Sometimes you even see a panurethral stricture, which affects the entire length of the tube. And then there are these incredibly severe cases called distraction defects. Those happen when traumatic pelvic fractures literally pull the ends of the membranous and bulbar urethra completely apart. All right, section 3, global causes and trauma. Why the pipes fail. We see a really striking geographical contrast when looking at comparative studies. Over in the West, 35% of strictures are iatrogenic. That means they were actually caused by medical treatments themselves, most commonly from urethral catheterization or procedures like a transurethral resection of the prostate. But look at India. Over there, 36% of cases are trauma-related, while those iatrogenic causes are much lower. It's just a completely different clinical landscape depending on where you are in the world. That 6% number is super important. It represents India's share of global traffic accidents. Now, what's wild is that they have this massive accident rate despite possessing only about 1% of the world's automobiles. This very specific infrastructure challenge perfectly explains why doctors there see such a high rate of those severe pelvic fracture urethral distraction defects we talked about just a minute ago. The external environment directly dictates the internal anatomy of the injury. Which brings us to another highly unique regional challenge. In Southeast Asia, there are close to 400 million tobacco users, incorporating both smoked and chew tobacco. In fact, an estimated 47% of Indian males over the age of 15 use tobacco. So why does this matter for urethral strictures? Well, one of the primary ways to surgically fix a stricture is by grafting tissue from the inside of the patient's cheek, a buccal mucosal graft. Studies actually show the long-term success of these cheek grafts is inferior in tobacco users because their oral tissue is compromised. It's a mind-blowing example of how a lifestyle habit in your mouth directly impacts a surgical reconstruction in your pelvis. Moving to section 4, the myoplasty solution, restoring the flow. So for strictures right at the external opening, the meatus, which are often caused by instruments, catheters, or childhood surgeries, urologists rely on a highly localized procedure. According to guidelines from the British Association of Urological Surgeons, one incredibly effective technique is called the Blandy myoplasty.
It usually takes about an hour under general anesthetic and uses a cleverly folded flap of the patient's own skin to reconstruct the opening. Let's actually walk through the steps of this biological engineering. First, the surgeon makes an incision on the underside of the head of the penis, cutting right through the narrowed, scarred area until they reach healthy, wide-open urethra. Then they fold back a tongue or flap of skin. Finally, they use dissolvable stitches to attach the skin flap to the divided edges. It's a fascinating, almost origami-like process of incising, folding, and stitching to permanently widen that final bottleneck, completely bypassing the need to harvest tissue from the mouth. The absolutely crucial takeaway from this specific surgery is that the opening is actually relocated. The meatus will no longer sit at the very tip of the penis. Instead, it gets permanently repositioned slightly further back, right on a level with the coronal groove, which is that rim just behind the head of the penis. This new normal position is totally essential to ensure long-term flow and to prevent the scar tissue from simply closing the pipe right back up again. And that brings us to Section 5, Recovery and Realities. Life after reconstruction. Look, while the success rate for these reconstructions is quite high, patients definitely have to navigate a few temporary hurdles once they get home. According to patient leaflets, anywhere from 1 in 2 to 1 in 10 patients will experience swelling, discomfort, and bruising around the wound site. It's also incredibly common to have mild burning or occasional bleeding when passing urine for a short time after the procedure. It makes sense, right? That newly stitched urethral pathway is healing and adjusting to the flow of liquid. And here is a very real, surprisingly relatable side effect noted by the British Association of Urological Surgeons. Because of the post-surgical swelling, the newly widened opening, and a much more forceful stream of urine now that the blockage is gone, between 10% and 50% of patients will experience significant spraying. The reality of this new physical dynamic is that many patients simply have to sit down to pass urine, at least for a little while, until the swelling subsides and they get used to the new flow. To wrap up this explainer, I want to leave you with this thought. We've seen how a problem identified by ancient healers 5,000 years ago is still being managed today. But we've also seen how modern variables, things like the rising rate of traffic accidents in developing nations and the widespread, persistent use of tobacco, are creating entirely new complexities for these surgical repairs. As our environments, our medical tools, and our daily human habits continue to evolve, what will be the next chapter in our quest to master and maintain human anatomy? Thank you so much for exploring the incredible science of human plumbing with me today.